This is Dr. Sharma, maxillofacial prosthodontist and implantologist from Colnel's Dental Spa, Bangalore, India. The portion of the tooth that we see in the mouth is called the crown of the tooth. More than half of the tooth is under the gums inside the bone, which is called the root of the tooth. An implant is a titanium insert that replaces the root of the tooth. Implants are fixed long-term replacement for missing teeth. Generally, when a tooth is removed, it takes about 3 to 4 months for the whole wound and the socket to heal and bone to get consolidated in that area. Implants are then placed in good bone and again left for about 12 to 14 weeks for the osseointegration or the implant to heal. During this time, bone grows around the surface of the implant, which is called osseointegration. Now, there is a direct bone contact in osseointegration on the implant surface, which means that the bone grows on the implant surface at a molecular level. Now, only thereafter 12 to 14 weeks, the implant can be loaded. That means a crown can be placed on the implant. Now, time is of essence. Nobody wants to wait that long. Now, there are times when an implant is immediately placed after extraction of a tooth, so that during the time taken for the extraction socket to heal, the implants also gets osseointegrated. Immediate placement of an implant after extraction has certain guidelines, and the implant systems in such cases are also different. These implants are more aggressive with a sharper bone engaging screw design to engage the bone for better primary stability. Now, titanium implants, whether placed in an extraction socket or in a healthy bone, will take almost 12 to 14 weeks for osseointegration, after only which the crowns can be placed on top of the tooth or the implant can be loaded, as we say. There are some implant systems called the basal implant systems which do not osseointegrate because they have a polished surface. They work purely on mechanical retention. They engage the cortical bone, and these implants can be loaded immediately, but there is no concept of osseointegration happening there. There are also some implant systems where the bone is not available in crucial areas, called all-on-4 and all-on-6 implant systems. These are called the active implant systems, which can be loaded also immediately. But even if they are loaded immediately, the type of crowns or bridges that are placed on it are interim, and after about 12 to 14 weeks, only permanent teeth can be placed on top of them. Studies have shown that immediate implants have a lower success rate and cannot be done in all the cases. Choosing a case is very important. Patient selection and treatment planning plays a very important role so that the success of immediate implants is ensured. It is important to choose not the implant system, rather I feel that it is important to choose a good dentist for the success of the implant. Let your dentist then choose the implant system which is most suitable for you. At Colnel's Dental Spa, we specialize in all the better implant systems. We have a very strict protocol and for patient selection for a particular implant system which is best suited for the patient's specific needs.